Most people wait for a blood test to tell them their blood sugar is too high. They wait for a doctor to say the word. They wait for the diagnosis to arrive before they start paying attention. And by the time that conversation happens, the elevated blood sugar has often been doing quiet damage for years. Sometimes a decade, sometimes longer. But here is something most people are never told. Your feet know before your doctor does. The nerves in your feet are among the longest and most vulnerable in the entire body. The small blood vessels that supply them are among the first structures to be affected by sustained high blood sugar. And the changes that happen in foot tissue when blood sugar begins to climb are often visible or feelable years before a formal diabetes diagnosis is ever made. This video is not about scaring you. It is about giving you a framework. 9 specific changes in your feet that your body uses to tell you something is shifting in your metabolic health, and what each one means, and what to do when you notice it. Before anything else, what I share in this video is educational information only. It is not medical advice. If you are experiencing any of the symptoms I am about to describe, please speak with your healthcare provider. Early evaluation changes outcomes dramatically in metabolic and diabetic foot health. What I want to give you today is the knowledge to have that conversation sooner rather than later. I am Dr. Andrew Carter, 15 years working exclusively with adults over 60. And the reason I want to make this video is that I have sat across the table from too many people who noticed something in their feet months or years before their diagnosis and dismissed it. They thought their feet were cold because of poor circulation from aging. They thought the tingling was a pinched nerve. They thought the dry skin was just dry skin. And it was not. It was not only that. Their feet were telling them something their annual blood test had not caught yet. If this is your first time on this channel, subscribe right now. Every week I bring you specific, clear information about what your body is trying to communicate after 60. You belong here. Let me give you the biology first, because understanding what elevated blood sugar does to the foot changes how you read every symptom I am about to describe. The foot is, in many ways, the furthest point from the heart and the central nervous system. The nerves that supply sensation to the soles and toes travel from the spinal cord down through the entire length of the leg. The blood vessels that carry oxygen and nutrients to foot tissue branch off from progressively smaller arteries until they become capillaries, the smallest vessels in the body. And both of these systems, the nerves and the small blood vessels, share a common vulnerability to elevated blood glucose. Here is how that damage happens. When blood sugar is consistently elevated, glucose molecules attach to proteins throughout the body in a process called glycation. Glycated proteins lose their normal function. In the walls of small blood vessels, glycation causes the lining to thicken and stiffen. The vessel becomes less able to dilate in response to tissue needs. Blood flow slows. The tissue it was supposed to nourish begins to receive less oxygen, less glucose for energy, fewer immune cells, fewer of the growth factors needed for repair. At the same time, elevated glucose damages the Schwann cells that wrap around nerve fibers and maintain the myelin sheath. Without adequate myelin maintenance, the nerve loses its ability to transmit signals accurately. Early on, this produces abnormal sensations, tingling, burning, a sense of pins and needles. Later, as the damage progresses, sensation begins to decrease. Eventually, in advanced diabetic neuropathy, sensation may be lost almost entirely in the foot. This is the combination that makes diabetic foot complications so serious. Reduced circulation means wounds heal slowly and infection spreads easily. Reduced sensation means injuries are not felt. A person steps on something or develops a pressure sore from a poorly fitting shoe and does not feel the pain that would ordinarily prompt them to act. By the time the wound is noticed, it has had days or weeks to develop unchecked. A study published in the journal Diabetes Care found that peripheral neuropathy, the nerve damage in the extremities driven by high blood sugar, was present in up to 50% of adults with type 2 diabetes. And critically, in a significant proportion of those cases, neuropathy was already detectable at the time of diagnosis, meaning the damage had been accumulating during the years of prediabetes that preceded it. Type in the comments right now which of your foot symptoms you have dismissed as something else. Cold feet you thought was just age. Tingling you thought was a sleeping position. Dryness you thought was the weather. Because the comment section below this video may show exactly how many people are walking around with early signals they have not connected to their blood sugar. The first thing to pay attention to is tingling or a burning sensation in the feet, particularly in the soles and the tips of the toes. This is often the earliest neurological symptom of elevated blood sugar. It happens because the small nerve fibers that carry sensation from the foot surface are among the first to be affected by the metabolic changes associated with sustained high glucose. These fibers are thin, lightly myelinated, and energetically demanding. They are also the ones responsible for temperature sensation and fine touch. When these fibers begin to be affected, the signals they send become abnormal. Instead of the accurate sensation of warmth, pressure, or texture, the brain receives a distorted signal. It interprets that distortion as tingling or burning, or a feeling described by many patients as walking on sand or on carpet when there is no carpet. Sometimes it is worse at night, when distractions are gone and the nervous system is in a quieter state. Sometimes it is worse after sitting for long periods, when circulation to the lower legs has been reduced by the compressed position. Many adults attribute this to a pinched nerve in the back, to poor circulation from aging, or to the way they were sitting. And sometimes they are right. But when the tingling is bilateral, meaning present in both feet, when it is symmetrical, starting at the toes and moving up in a stocking-like distribution, and when it is persistent, rather than positional, these are the features that distinguish small fiber neuropathy from a simple mechanical nerve issue. Mechanical nerve compression is almost always one-sided. Metabolic nerve damage is almost always symmetrical. A study published in the journal Neurology found that small fiber neuropathy was detectable in adults with prediabetes before formal diabetes criteria were met. The researchers specifically noted that the tingling and burning symptoms appeared an average of 4 years before the patients received a diabetes diagnosis. 4 years, during which time the nerves continued to be exposed to the elevated glucose that was damaging them. If you have tingling or burning in both feet that is not clearly positional, that has persisted for more than a few weeks, and that you cannot fully explain, please bring that symptom to your doctor and ask specifically about your fasting glucose, your HbA1c, and a simple nerve function assessment. The second thing to notice is numbness, and particularly the gradual loss of sensation that can be so slow it is barely perceptible. This is a later stage of the same process. As the nerve damage from elevated blood sugar progresses, the abnormal signals, the tingling and burning, eventually give way to no signal at all. The nerve fibers that once transmitted distorted information begin to fail entirely. The foot that once burned now simply does not feel. This is where the danger escalates significantly. A foot that cannot feel a cut or a blister, or the pressure of a stone in the shoe, is a foot that can develop a wound without the person ever knowing it is there. And in a foot that also has compromised circulation from small vessel disease, that wound will not heal the way it should. The way most people first notice this is not by feeling numbness directly. They notice it by noticing things they no longer feel. They notice that hot water they would once have found uncomfortably hot now feels only mildly warm. They notice that they stubbed a toe and felt surprisingly little. They notice that a sock seam they had been wearing all day had rubbed a raw area they only discovered when they changed for bed. Check your feet tonight. Run your fingertip firmly along the sole from heel to toe on each foot. Is the sensation equal on both sides and equal at the heel compared to the toes? Many adults with early diabetic neuropathy find that their toes have less sensation than their heel, or that one foot feels different from the other, even when both are affected. This asymmetry or gradient is a clinical finding worth bringing to a doctor's attention. The third sign is cold feet, specifically a persistent coldness in the feet and lower legs that is not relieved by warming the room or wearing thicker socks. Cold feet in adults over 60 is extremely common and has many causes. But in the context of blood sugar concerns, the relevant mechanism is peripheral arterial disease, the narrowing and stiffening of the arteries supplying the legs and feet from the same glycation-driven vascular damage we discussed earlier. When the arteries supplying the foot are narrowed, blood flow at rest is reduced. The foot cannot warm itself adequately from the inside. It feels cold to the touch, and it feels cold to the person wearing it. This coldness is often worse in the toes than the heel, because the toes are furthest from the arterial supply and first to feel the effect of reduced flow. If your feet are cold and warming them externally produces temporary relief that returns, as soon as the external heat is removed, the coldness is likely circulatory in origin rather than environmental. A foot with healthy circulation regulates its own temperature. A foot with compromised arterial supply cannot. The clinical test your doctor can perform is called the ankle brachial index, a simple non-invasive comparison of blood pressure at the ankle versus the arm, that gives a direct measure of how well blood is flowing to the lower leg. Now, ask for it by name. And if you have not yet subscribed to this channel, tap that button right now and ring the bell. Every week I come back here with exactly this kind of specific, usable information. I want to tell you about Eleanor, 71 years old, retired teacher from Phoenix, Arizona. She came to me not because of her feet specifically, but because of fatigue that had been building for about 2 years. She described her energy as halved. She was sleeping 8 hours and waking up tired. When I did a full review of her health, I asked about her feet. She mentioned, almost as an afterthought, that her feet had been cold for as long as she could remember, and that for the past year she had been getting what she called this strange buzzing in the soles at night. She had not mentioned it to her previous doctor, because she had assumed it was a side effect of the blood pressure medication she had been on for 4 years. Monsieur. So her fasting glucose was 119. Her HbA1c was 6.1%. She was in the pre-diabetic range, and had been, based on the trajectory of her numbers, for probably 2 to 3 years. The cold feet were circulation. The buzzing was early small fiber neuropathy from sustained pre-diabetic glucose levels. Neither symptom had been connected to her blood sugar, because nobody had looked at them together. We addressed her glucose with dietary and lifestyle changes, working with her primary care physician. We added specific monitoring of her foot sensation every 6 months. And we had a conversation about the medication her fatigue might actually be related to, which turned out to be another piece of the picture entirely. 8 months later, her HbA1c was 5.7. Her foot buzzing had reduced meaningfully. She told me, I had been living with those symptoms so long I thought they were just me. I told her, they were you. They were your body trying to tell you something, in the only language it had. The fourth sign is slow healing wounds, cuts, or blisters on the feet. Most small injuries heal in a predictable time frame. A minor cut on the foot in a person with healthy blood sugar and healthy circulation closes within a week, typically. A blister from new shoes resolves in 5 to 7 days. The skin repairs itself through a cascade of well-orchestrated biological steps: platelet aggregation, inflammation, collagen synthesis, tissue remodeling. Every one of those steps is impaired by chronically elevated blood sugar. Platelets clump less efficiently in high glucose environments. The inflammatory response, which is supposed to be precisely timed, becomes dysregulated. Collagen synthesis slows because the enzymes involved are glycated and less active. And the circulation that is supposed to deliver all the raw materials for repair is reduced by the small vessel disease we already discussed. The result is a wound that is still open after 2 weeks. Still open after 3. Sometimes progressing backward, developing the edges of a chronic wound rather than the margins of a healing one. And because sensation may also be reduced, the person may not even feel the discomfort that would otherwise drive them to seek care. Any wound on the foot that has not shown clear signs of healing after 2 weeks deserves medical evaluation. That is not an overreaction. That is the correct clinical threshold. Wounds that stay open on diabetic or pre-diabetic feet can develop infections that, in a compromised circulatory environment, spread rapidly and are difficult to treat. Diabetic foot ulcers are the leading cause of non-traumatic lower limb amputation globally. They begin as wounds that people waited too long to have evaluated. If you have a cut, blister, or pressure sore on your foot right now that has been there for more than 2 weeks and is not clearly smaller than when it started, please call your doctor tomorrow morning. Not next week. Tomorrow. The fifth sign is dry, cracked skin on the heels and soles, particularly cracking that is deep, painful, or recurrent despite regular moisturizing. The skin of the foot is maintained in its normal supple state by a combination of local sweat gland activity and the circulation that keeps the tissue adequately hydrated from within. The sweat glands in the feet are regulated by the autonomic nerves, the nerve fibers that control automatic body functions. These autonomic fibers are also among the early targets of diabetic neuropathy. When autonomic nerve function in the foot is reduced, sweat production decreases. The skin loses one of its primary sources of surface moisture. It becomes dry. It cracks. And the cracks in a foot with reduced sensation are often not painful in the way they would be in a healthy foot, meaning they can deepen significantly before the person treats them. Deep heel cracks are not just a cosmetic issue. They are entry points for bacteria. In a foot that already has reduced immune surveillance from compromised circulation, a heel crack that becomes infected in a person with uncontrolled blood sugar can be the beginning of a much more serious problem. The daily foot inspection habit, established now, regardless of whether you have a diabetes diagnosis, is one of the most protective things an adult over 60 can do for their long-term foot health. The sixth sign involves something that many adults over 60 notice and dismiss as a circulation issue, without thinking further about it. Swelling in the feet and ankles, particularly swelling that is worse toward the end of the day and better in the morning after sleeping with the legs horizontal. Nazisme, swelling has many causes. Not Mirasad, heart failure, venous insufficiency, kidney disease, medication side effects. But in the context of blood sugar concerns, the relevant mechanism is twofold. First, early kidney involvement from diabetic nephropathy reduces the kidney's ability to manage fluid balance, causing fluid to accumulate in the tissues of the lower legs. Second, the small vessel disease that reduces arterial inflow to the foot also impairs the venous outflow, the return of fluid from the tissue back into the circulation. The feature that makes swelling more concerning in this context is when it accompanies other foot symptoms, particularly tingling, coldness, or slow-healing skin. A single symptom in isolation has a wide range of explanations. 2 or 3 symptoms present simultaneously narrows that range significantly. If your feet and ankles are swollen, and you also have any of the other symptoms described in this video, please bring the complete picture to your doctor. The combination is more informative than any individual symptom alone. Type yes in the comments right now if you have more than one of the symptoms I have described so far, and have not yet spoken to your doctor about any of them. Because if the answer is yes, this video is doing exactly what it was intended to do, giving you the reason to pick up the phone. And share this video right now with one person in your life over 60 who you think might be experiencing some of these things and writing them off. You might be giving them the conversation they needed to have. The 7th sign is changes in skin color in the feet, specifically a reddish or bluish discoloration, or patches of skin that are noticeably darker or lighter than surrounding areas. Color changes in foot skin reflect changes in blood flow and tissue health. When arterial blood flow is reduced, the foot may appear pale when raised and deep red or blue when placed below the level of the heart. This color change with position is called dependent rubor. It is a sign of significant peripheral arterial disease and warrants urgent vascular evaluation. Patches of dark discoloration on the ankles and lower legs can represent chronic venous insufficiency, which often coexists with arterial disease in people with long-standing elevated blood sugar. Lighter patches can reflect tissue that has had its circulation compromised for an extended period. Any new or changing skin discoloration on the foot or lower leg, particularly alongside other symptoms, deserves evaluation. Take a photograph today and bring it to your next appointment. The 8th sign is recurrent fungal infections of the toenails or skin, the kind that respond partially to treatment and then return, or that have been present in a low-grade way for months or years. The immune environment of a foot with elevated blood sugar is compromised. White blood cells that would ordinarily patrol the skin and clear fungal organisms function less efficiently in a high-glucose environment. The glucose itself provides a ready nutrient source for the fungal organisms that live on skin surfaces. And the reduced circulation means that oral antifungal medications reach the nail bed and deep skin layers in lower concentrations than they would in a foot with healthy blood flow. The result is an infection that resists treatment, a nail that has been treated with antifungal medication multiple times and keeps coming back, a patch of athlete's foot between the toes that responds to cream and returns 6 weeks later. These recurrences, in the absence of other explanation, are a clinical signal that the local immune and circulatory environment is not functioning normally. The 9th sign is hair loss on the feet and lower legs, the gradual disappearance of the fine hairs that normally grow on the dorsum of the foot and the lower shin. This is perhaps the least well-known of the 9 signs, and it is also one of the most specific indicators of reduced arterial blood flow to the lower leg. Hair follicles are metabolically demanding structures. They require an ongoing supply of oxygen and nutrients to maintain hair growth. When arterial perfusion to the lower leg is chronically reduced, the hair follicles are among the first structures to downregulate their activity. Hair growth slows and eventually stops. In a healthy adult, the top of the foot and the lower leg carry a visible amount of fine hair. In an adult with significant peripheral arterial disease, whether from long-standing diabetes, from atherosclerosis, or from a combination of both, the lower leg below the knee is often hairless. The skin has a smooth, shiny quality from the same reduced circulation. Look at your own lower legs right now. Compare the hair density from the mid-shin to the ankle and the top of the foot. If the lower portion is significantly less hairy than the upper, or the top of your feet are smooth and shiny, when they were not a few years ago, that observation is clinically relevant. None of these 9 signs taken alone is a diagnosis. What they are is a reason to seek evaluation. A reason to have your fasting glucose and HbA1c checked. A reason to stop explaining away the symptoms and start asking what is behind them. Let me talk now about what you can do, starting today, to protect your foot health and support your blood sugar. The first and most important habit is the daily foot inspection I mentioned earlier. Every day. Shoes off, socks off. Every surface examined in good light. Look between the toes. Look at the heel. Look at the skin color. Feel for temperature differences between the 2 feet. This takes 2 minutes. And it is the single practice most recommended by diabetic foot care specialists for adults at any stage of blood sugar concern. Problems caught early are managed easily. Problems caught late are managed with difficulty, or sometimes not at all. The second habit is walking. Specifically, walking after meals. A 10 to 15-minute walk after the main meal of the day blunts the postprandial blood glucose spike that follows eating. It activates the muscles of the lower leg, which act as a pumping mechanism for venous return and improve circulation to the feet. And it supports the kind of consistent, sustained movement that is the most evidence-based lifestyle intervention for blood sugar management available. A study published in Diabetologia found that short walks after each meal were more effective at reducing 24-hour blood glucose exposure than a single longer walk at a fixed time of day. The third habit is footwear. Shoes that fit properly, with adequate width at the toe box without seams pressing against the toes or heel. In adults with any degree of reduced sensation, a shoe that would cause minor discomfort in someone with full sensation can cause a significant wound without ever being felt. Footwear is a health decision. The fourth habit is hydration. Adequate fluid intake maintains blood viscosity, and the microcirculation of the foot depends on adequate blood fluidity. 6 to 8 cups of water through the day, consistent, not caught up in the evening. The fifth habit is having your blood sugar checked. If you have any of the symptoms described in this video and have not had your fasting glucose and HbA1c measured in the last year, schedule that test. It is a standard blood panel component, and the information it provides, particularly if your numbers are in the pre-diabetic range, gives you a window of opportunity that closes as the years pass without intervention. 4 things I want you to take away from this video and carry into your next appointment, or into tonight when you take off your shoes. First, your feet are one of the earliest diagnostic surfaces in the body for metabolic and circulatory health. The symptoms they produce, the tingling, the coldness, the dryness, the slow healing, the discoloration, the hair loss, are not incidental. They are specific. They have mechanisms, and they appear, in many cases, before a blood test has caught what is happening. Second, any 2 or more of the 9 signs I described appearing together in the same person should prompt a conversation with a doctor about blood sugar evaluation. Not a worried assumption, not a diagnosis, but a conversation with the right blood tests within the next few weeks. Third, the daily foot inspection habit, established now and maintained consistently, is one of the highest leverage health practices available to adults over 60. It takes 2 minutes. It catches problems at a stage where they are still straightforward to address. And it builds the kind of body awareness that is genuinely protective over the long term. Fourth, early action changes outcomes in metabolic health in a way that almost nothing else does. The difference between prediabetes identified and addressed and prediabetes ignored for 5 years is, in many cases, the difference between reversibility and management. Between a condition corrected with lifestyle and a condition requiring lifelong medication. The window is real. It is open. And it opens in part through the signals your feet are already sending. Your feet have been carrying you for your entire life. Every step on every surface across every decade. They do not ask for much. What they are asking for right now is that you look at them, listen to what they are telling you, and take that information somewhere it can actually be used. You are not broken. The symptoms you have been dismissing are not personal failures. They are information, and now you know how to read them. Share this video with one person over 60 in your life who mentions foot problems and dismisses them as normal aging. You might be giving them the reason to finally have the conversation that changes their health trajectory. And subscribe to this channel, because every single week I come here with one purpose: to give you the specific information your body has been trying to communicate in language you can actually use. Aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. Take care of yourself.